Hello everyone. In this class, we learn about cerebral circulation. The objectives of this class would be to give normal value of cerebral blood flow, which is expressed in ml per 100 gram per minute and total for organ per minute. List the special features of cerebral circulation and say how is blood-brain barrier is formed and what is its importance. Name the arteries supplying blood to different parts of the brain and parts of circle of Willis. Name the methods of measurement of cerebral blood flow and give the principles of measurement. Understand the regulatory mechanism of cerebral circulation and appreciate the importance of autoregulation of cerebral blood flow. And know the basic pathophysiology of stroke and learn the physiological basis of their treatment. Brainstem contains cardiovascular and respiratory centers. Hypothalamus controls visceral functions including regulation of body temperature. Cortex is the seat of all higher cognitive functions including language and speech. Sensory processing, motor activities and behavioral functions are integrated in different parts of the brain. Thus, adequate cerebral blood flow is essential for the brain to carry out all these important functions, which is one of the primary objective of cardiovascular system. Viability of the brain is so important that medical legal cases brain death is confirmed when there will be absence of EEG tracing before declaring the death of an individual. Cerebral metabolism. Brain tissue is highly sensitive to hypoxia. Stoppage of blood flow for more than 15 to 30 seconds results in unconsciousness, and for more than 5 minutes causes irreparable damage that may sometimes leads to coma. Brain utilizes glucose as a main fuel. Therefore, prolonged hypoglycemia results in cerebral dysfunction. However, in conditions of chronic scarcity, the brain can utilize ketone bodies. Metabolic requirements of brain remain fairly constant irrespective of activities of the brain tissue and cerebral blood flow. Cerebral blood flow. Some of the special features of cerebral blood flow are cerebral arteries are end arteries. Increase in cerebral blood flow is usually associated with comparable increase in venous outflow. In the brain, volume of blood and extravascular fluid remains relatively constant. The change in one component is associated with opposite alteration in other. The capillaries in brain are mostly non-fenestrated. Presence of blood-brain barrier, that is, the cerebral blood flow are surrounded by the end feed processes of astrocyte, which provides anatomical basis for the formation of blood-brain barrier. Due to the presence of blood-brain barrier, substances from brain tissue like neurotransmitter cannot easily enter general circulation, and substances from blood also cannot easily enter the brain tissue. Blood-brain barrier provides protection to the brain from toxic and harmful substances circulating in the blood. As brain-blood barrier is not well developed in infants and children, kernicterus occurs in them in hemolytic jaundice. The mechanism for vesicular transport from blood into brain tissue via endothelial wall of the cerebral vessels is less developed. The tight junctions between endothelial cells of capillaries are very tight and do not permit the passage of substances through them. The basement membrane of the capillary is also thick. So this diagram showing the blood-brain barrier where it is made up of the end feed process of astroglia and the tight junctions of endothelial capillary cells and also the thick basement membrane. Cerebral blood vessels. The vertebrobasilar system. Two vertebral arteries join to form basilar artery, which finally merges to circle of Willis. The two internal carotid arteries. The two internal carotid arteries along with basilar artery forms the circle of Willis. The circle of Willis, which is formed by the basilar artery and two internal carotids, give rise to three pairs of large vessels supplying the brain. These are anterior cerebral, middle cerebral and posterior cerebral arteries. Functionally, they are end arteries. Therefore, block in any of the artery results in ischemic damage to the part of supplied by the artery. So this diagram showing the circle of Willis, where it is made up of branches from the carotid artery and the basilar artery. It is going to give rise to anterior cerebellar artery, middle cerebellar artery, and the posterior cerebellar artery, and they are going to form the circle of Willis, and they are end arteries. Venous drainage occurs by deep veins and dural sinuses. They drain into internal jugular veins. If you look at this innervation of the cerebral vessels, they are supplied by sympathetic and parasympathetic. Sympathetic fibers are vasoconstrictors. Cell bodies of sympathetic neurons are located in the superior cervical ganglia. They release norepinephrine and neuropeptide Y at their nerve endings. Parasympathetic supply causes vasodilatation, and these fibers secrete acetylcholine and VIP. Cell bodies of cholinergic neurons are present in splenopalatine ganglion. Sensory neurons. The sensory nerves contains substance P, CGRP, neurokinin A, VIP, which cause vasodilatation. Cell bodies of sensory neurons are located in the trigeminal ganglia. The cerebral blood vessels are highly sensitive to pain. Pressure and cerebral blood vessels causes pain. Pressure on the cerebral vessels causes pain. But interestingly, the brain tissue does not receive pain fibers. Normal values of cerebral blood flow. The brain weighs about 1.4 kg. Total cerebral blood flow is 750 ml per minute, which is about 14% of the cardiac output. This accounts for about 54 ml of blood per 100 gram of brain tissue per minute. Oxygen consumption of the brain is about 45 ml per minute, which is about 3.3 ml per 100 gram per minute. Measurement of cerebral blood flow. Cerebral blood flow can be measured by various methods. The important methods are Ketty's method, by using radioactive substances, by using flow meters, PET scan, and SPECT scan, that is single photon emission computerized tomography. Ketty's method. This method uses fixed principle. In this method, nitric oxide is used. The subject inhales 15% of the nitric oxide for 10 minutes. The arterial sample and venous sample, they are collected, and the artery-venous difference is measured. The arterial sample is taken from any other peripheral artery, and the venous sample is taken from the internal jugular bulb. And then cerebral blood flow can be calculated as amount of nitrous oxide taken up by the brain divided by artery-venous difference of nitrous oxide across the brain. Then it can also be determined using radioactive substances. Radioactive substances usually used as a radioactive xenon. The substance is injected into the carotid artery, and the radioactivity of the different areas of the brain is measured by placing scintillation counters around the skull. This is useful method for studying the regional distribution of the cerebral blood flow in different parts of the brain. Using flow meters, the flow meters can be directly placed on the cerebral arteries in experimental animals or in patients undergoing neurosurgery, and cerebral blood flow can be measured accurately. Positron emission tomography. This is mainly used in monitoring the regional blood flow of various parts of the brain. This method, short-lived radioisotope is used to label the substance which is injected. Scintillation detectors placed on the head monitor the appearance of the clearance of the tracer. The information from detectors is processed in a computer that quantifies the flow in a particular region of the brain. Single photon emission computerized tomography is also used for the purpose. Then MRI, that is magnetic resonance imaging. This technique is based on the detecting resonant signals from different tissues in a magnetic field. The resolution of MRI is better than PET. Recently developed fMRI, that is functional magnetic resonance imaging, measures the blood supply to a specific area of the brain. Regulation of the cerebral blood flow. The role of intracranial pressure. The brain tissue and cerebrospinal fluid are incompressible. Thus, at any given time, the total volume of blood, CSF volume, and brain tissue in the cranial cavity remains constant, and this is called as Monro-Kelly doctrine. The rise in the intracranial flow, that is intracranial pressure, results in compression of the cerebral arteries that decreases blood flow. Increase in arterial pressure as occurs during downward acceleration increases arterial pressure in the head. However, intracranial pressure also rises simultaneously. Increased ICP prevents rupture of the blood vessels by supporting them. In brain tumors, compression of the cerebral vessels decreases the blood flow. Decreased blood flow causes hypoxia at the vasomotor center, and this activates Cushing's reflex, which attempts to restore cerebral blood flow. Coming to neural regulation, stimulation of the sympathetic fibers causes vasoconstriction, but it is not important as vasoconstrictor system is not well developed in cerebral vascular bed. Parasympathetic stimulation causes vasodilatation. Then metabolic regulation. Cerebral blood flow is altered by production of local vasodilator metabolites like potassium, hydrogen, and adenosine. Acidosis, hypoxia, and hypercapnia in the brain tissue produce potent vasodilatation and thereby blood flow. It has been demonstrated that 70% increase in the arterial PCO2 approximately doubles the cerebral blood flow. So this diagram shows the association between arterial PCO2 and cerebral blood flow. As the arterial PCO2 increases, the blood flow it leads to vasodilatation and it increases the blood flow. Role of astrocytes, which with increase in the neuronal activity, chemical substances like nitric oxide, metabolites of arachidonic acid, potassium, adenosine are released from astrocyte, which causes vasodilatation and increases cerebral blood flow. There is also autoregulation. See, cerebral blood flow remains relatively constant within a range of 60 to 140 mm of blood pressure. The autoregulation may be due to the neural and metabolic factors. This diagram shows about the autoregulation which is happening in the cerebral blood flow, where the blood flow relatively remains constant between the systemic arterial blood pressure between 60 to 140 mm of Hg. It involves mainly the neural and metabolic autoregulation. Some of the clinical aspects. Stroke. It is a syndrome of rapid onset of neurological deficit that is attributable to the focal vascular cause. As per WHO definition, stroke is rapidly developing clinical signs of focal or global disturbance of cerebral function with symptoms of lasting for 24 hours or longer, or may leading to death with no apparent cause other than the vascular origin. Progressive stroke is the one which neurological deficits worsen after patient first present, and in complete stroke neurological deficit does not progress beyond 96 hours. There are two types of strokes, ischemic stroke and hemorrhagic stroke. About 70% of the stroke is ischemic stroke and 17% is hemorrhagic stroke, and 3% is others that include venous sinus thrombosis, AV malformation, and aneurysms. Ischemic stroke occurs due to the blockage of cerebral artery by thromboembolism. Cerebral infarction is the most commonly caused by thromboembolic disease secondary to atherosclerosis in the major extracranial arteries such as carotid artery and aortic arch. 20% of the infarctions are caused by emboli from the heart, and 20% are due to thrombosis in situ caused by intrinsic disease of small perforating vessels producing lacunar infarction. So this is the pathophysiology of the stroke, it is caused by thromboembolus, so which can lead to activation of the procoagulant pathways, which further increases the vascular accidents. Then it is going to lead to the hypoperfusion of the tissue, where there will be ATP depletion, and it is leads to activation of the lipid peroxidase, protease, enosynthase system that increase the free fatty acid release. This also leads to destruction of the intracellular organelles, cell membranes, and release of free radicals, which ultimately leads to liquefaction necrosis of the affected area. Hemorrhagic stroke. Hemorrhagic stroke is caused by bleeding directly in the brain tissue. Usually this occurs due to the rupture of branch of cerebral artery at the site of aneurysm. Rupture of Charcot's artery, the artery of cerebral hemorrhage, that is the lenticulostriate branch of middle cerebral artery, is the common cause of stroke, and that produces contralateral hemiplegia. Treatment of stroke. Intravascular thrombolysis. Fibrinolytic drugs like recombinant tissue plasminogen activator given in early course of the stroke is very useful. Then endovascular mechanical thrombectomy, very useful, especially if there is a contraindication for thrombolysis. Anticoagulation therapy for acute ischemic stroke is done in patients with high risk of early cardiogenic reembolization and cerebral venous thrombosis. Antiplatelet therapy. Aspirin 175 milligrams daily reduces stroke related morbidity and prevents early stroke recurrence. Excitotoxic drugs. Normally brain cells take up and utilize glutamate. Ischemia of the brain tissue decreases uptake, glutamate uptake that increases the local glutamate concentration. Glutamate causes excitotoxic neuronal damage to the brain tissue. Therefore, the anti-excitotoxic drugs are quite useful in the treatment of stroke. Then supportive care like maintenance of the blood pressure, serum glucose, control of intracranial pressure, uh, catheterization, prevention of the complication, and physiotherapy plus other measurements of neurohabilitation, uh, they're going to help in the management of the stroke. So this is in brief about cerebral circulation. Thank you.